So a little bit of just the basics on the etiology of foot and mouth disease, which I'm sure you're all familiar with. So it belongs to the family Picornaviridae, so that means it's a small RNA virus. And you will probably know other Picornaviridae such as polio in man and rhinitis viruses that affect humans and animals. It's a member of the genus Aphthovirus, aphthous meaning a vesicle, and it exists as 7 different serotypes. And in addition to the 7 serotypes, which complicate matters when we come to control of the disease, there are also multiple strains within some of the serotypes. So it's a very variable virus. It's inactivated by heat, and it's not very stable outside of the neutral pH range. So it's readily inactivated by acids or alkalis. And in fact, it has a moderate or low environmental persistence. So this, of course, depends on many factors, not least temperature. But in general terms, you can say it will only survive weeks or perhaps months in the field. In the Caribbean, probably we're talking weeks. But it is important that it can survive in animal products. So although the rigor mortis that takes place will inactivate the virus in the muscle because of the low pH, as long as the pH drops below 6, the virus can still survive in the bone marrow and in the lymph nodes. And it can also survive in the muscle if you don't get proper rigor mortis, for instance, if you have a fever in the animal. So that's also important for the routes of spread. So the picture here, you can see the virus particle, which is a protein capsid. It has no envelope, and you can see here the 7 different serotypes of the virus as far as the genetic relationship goes. So a little bit about the different viruses. All of the serotypes cause essentially the same disease, so you've got more or less one disease. But there are some strain differences, for instance, in host specificity. So there are, for example, viruses that occur in Asia that have a particular deletion in a part of the genome, which means that they only readily infect and cause disease in pigs, and they don't spread or cause disease in cattle. In addition, 3 of the serotypes, the South African types, are essentially adapted to African buffalo, and they largely occur in Africa. So the important difference between the serotypes is really about immunity, and the antigenic differences influence cross-protection. So that means that once you have recovered from one serotype, you can still be infected with another serotype, and it means that vaccines are needed for different serotypes and even for some different strains of the virus. So if we look at that in a little bit more detail in this table, the problem is perhaps not quite as bad as you might think at first sight, because in fact about 70% of all foot and mouth disease in the world is caused by a single serotype, which is type O. So this is much the most important serotype, and also this has limited antigenic diversity amongst strains. So if you have a good vaccine for type O foot and mouth disease, you can actually cover a lot of what is necessary. The next most common serotype is type A. This, unfortunately, is very diverse antigenically, and so you need many different vaccine strains to be able to cover all the different types of or strains of serotype A. But then the other 5 serotypes are much less prevalent in the world. So the SAT serotypes, which I've already mentioned and which are highly diverse, are a big headache for people in Africa, but they hardly occur outside of Africa, and so they are less of a problem in the rest of the world. The type C virus is actually possibly extinct and has not been isolated anywhere in the world since 2004, when it was last isolated both in the Amazonian region of South America, which was rather a mysterious case, and also in East Africa. And the Asia 1 virus, as its name suggests, is more or less occurs in parts of southern Asia. Okay, so we can look a little bit more at the geographic distribution here on this map. As we have seen, it takes a little bit of a while for people to submit all their reports to OIE. So really, if you look much later than the end of 2013, you don't unfortunately get a very full picture. But in fact, this picture doesn't change very much. And when I started on FMD 15 years ago or so, it was still largely similar, except perhaps with the improvements that have occurred in South America. So what you can see from here on the map is that the countries that are free, which are marked in green, are largely the economically prosperous and developed countries, because foot and mouth disease is quite difficult to control, and you need a lot of good resources and veterinary services to be able to get rid of it. And the countries that still have foot and mouth disease tend to be more in the developing world. And in particular now in Southern Asia and in Africa are the main hotspots for continuation of foot and mouth disease. It is, though, important to say that the countries that are marked as having foot and mouth disease, they're not all infected to the same extent. So there are some countries which maybe in Southern Asia and in parts of Africa, which are, if you like, primary endemic countries where foot and mouth occurs almost continuously. But there are many parts of the world which have sporadic cases but do not have continuous cases of FMD. And it's also important to remember that FMD is an epizootic disease, and it doesn't occur consistently all the time. It occurs in waves. This is very important to understand the epidemiology. So it is when you get these big occurrences of new waves of foot and mouth disease that there is a tendency for spread internationally, because you get a big build-up of infection in the endemic countries and then spread somewhere else. Okay, so it's one of the listed diseases, of course, so people have to report to the OIE. But in addition, because of its importance for trade, the OIE maintains official country status for foot and mouth disease freedom. And so that is what is shown on this map. And you can see in green the countries that are marked as being having free status for foot and mouth disease. And that can be either at the whole country level or at a zonal level. And it can be without vaccination, or it can be free with vaccination. And again, you can see here that the pattern is that the countries that don't have the official free status are largely in Asia and Africa. And you can also see the progress that has occurred in South America. You can see there are parts of South America in the extreme south and in Santa Catarina in Brazil that are free without vaccination, and also some other regions. And then there is a large part that is free with vaccination. And then you can see some other countries such as Venezuela, Ecuador, Suriname, and parts of Amazonia in Brazil, which are not yet officially free, but which have not actually had any outbreaks. And if we look at the story of foot and mouth disease in the Americas overall, we can see that North America has been free since 1954, that Central America and the Caribbean have never had FMD. And if we look at recent reports and summaries from Panaftosa about the situation in South America, you can see that 83% is now officially free, 64% free with vaccination, almost 20% without vaccination. Controls cost about $1.3 billion per annum to maintain FMD freedom. A lot of that is for vaccination, and employ 7,500 vets. So it has been a monumental effort over many decades to get to this state. And Panaftosa have attributed this success to surveillance systems, including risk-based serology, to systematic vaccination with quality-controlled vaccine, and this part is absolutely essential, and improved information and animal movement systems. And the plan for 2020 for the region is to get all areas officially free. So that would mean that the areas that are free with vaccination should move to being free without vaccination, and the remaining areas to become free without vaccination. Okay, so let's get back to the disease itself then. So first of all, thinking about the pathogenesis and what are the animals that get infected with foot and mouth disease and show the disease and spread the disease. The important point is that there are multiple host species, so that contributes to the difficulty for controlling the disease. So in terms of domestic species, cattle, water buffalo, sheep, goats, and pigs are all infected and transmit foot and mouth disease. In wild animals, there is also a very large number of animals that can become infected, but ones that have been of epidemiological importance are certainly African buffalo, where they occur. Deer have been important. They were important in North America in eradication of the disease there. Wild boar can be important. They were involved in outbreaks in Bulgaria in 2011. It's important that the disease is not a zoonosis, although there are occasional reports of foot and mouth disease in people, but they're not really fully substantiated. But there is a disease, hand, foot and mouth disease, which occurs in people, caused by a different virus, a Coxsackie virus, which looks a bit like foot and mouth disease. And it's quite common when you have outbreaks of foot and mouth disease to get reports of people who think they have got foot and mouth disease. So the life cycle of the virus is, first of all, to say it's a very contagious disease. It's famously described as one of the most contagious diseases known. And this is especially by the route of inhalation. So in cattle, it is estimated that an animal can be infected by a single particle. And in fact, the likelihood of infecting a cow with a single particle of FMDV is about 1 in 200. So it's not insignificant. In addition, though, animals can be infected by ingestion of virus, although they then need an enormously higher dose to successfully infect them, maybe 10,000 particles. The virus can also enter through damaged skin, and it's important to realize that there are host susceptibility differences. So cattle and sheep are the most susceptible to inhalation, and pigs are the most susceptible to infection by ingestion. The incubation period is quite variable because it depends on the dose. So if animals are infected with a very low dose, you will tend to get a longer incubation period, but it can be from 2 to 14 days. Virus shedding is maximal around the time of disease onset, and that can be, of course, very quick, because you can get, within 2 or 3 days of infection, animals shedding disease already, and that contributes to the contagious nature of the disease. Most secretions and excretions contain the virus and therefore are a risk. And in terms of species difference, pigs shed a great deal more virus in the breath than other animals. There is also the famous carrier state that occurs only in ruminants, so not in pigs. And this is where you can detect the virus in the oropharynx beyond a month after infection, and in the presence of an immune response and antibodies. It's a very controversial subject because it's not all that clear that these animals can actually transmit the virus successfully to other animals, and if they can, the risk is very, very, very low. But nevertheless, this has been a problem for trade rules and the application of the precautionary principle. So this really just summarizes the replication of the virus. It's a typical virus. After exposure, you get local replication, you get a viremia, you can get secondary viral replication, immune response, and recovery or the carrier state. An important point to note is that the latent period can be shorter than the incubation period, so you can get virus shedding before you get obvious signs of clinical disease. So transmission between animals then. The most important route for transmission by far is direct contact between animals. This is much the most effective way of spreading the disease, and this of course depends on livestock density. So if you keep animals very extensively, like sheep out on the side of a hill, the disease will not spread very effectively, and indeed it can die out in a flock and not. But if you have high densities of livestock, then the disease spreads very effectively. The virus is also present in products from infected animals, so meat we have already discussed, but also in milk, semen, and embryos. And in milk, for example, the virus can be present before animals show clinical signs. Fomites are also very important for the spread of the disease. So we're talking then about contaminated objects, which can be people, clothing, livestock, housing, vehicles, equipment and feedstuffs. All of these can be implicated. So for example, cases of introduction of foot and mouth into free countries have been associated with farm workers working in farms overseas and then returning to work in farms in a free country. They have been associated with importation of straw or hay from infected countries being fed to animals in free countries. And then finally, there is the windborne spread, the long-distance windborne spread, because in fact, direct contact is really often spread so via the air and via aerosols, but here we're talking about farm-to-farm spread of foot and mouth disease. And this requires rather special circumstances and mainly occurs from pigs to cattle and is mainly of importance in countries where there are temperate climates, where you have a high humidity and a relatively low temperature. So the clinical signs of foot and mouth disease are relatively straightforward. It's a vesicular disease and the main sign is actually vesicles. So you get these blisters that occur in the mouth and on the feet and sometimes elsewhere, particularly on the teats. And these rupture to give erosions which gradually heal over about a 10 to 14 day period. Associated with the acute signs of the development of the vesicles, you get drooling, champing of the teeth and lameness. You get a variable fever and malaise, which tends to be associated with the viremia at the early stage of infection. You get a profound milk drop in dairy animals, which is very severe and can lead to loss of most of milk production for that lactation. And you can also get secondary mastitis and problems thereafter. In neonates of all species, you can get sudden death, and this is due to the fact that in young animals, the virus is able to replicate in the heart muscle, and you get these, in amongst the red tissue, the healthy tissue, you can see the light-colored necrotic foci. But it's also very important to remember that the disease can be mild or subclinical, and this depends on the host, the virus, and the immunity, particularly on the host. So especially in small ruminants, in sheep and goats, the disease can often be very mild and quite easily missed. So a little bit on the field diagnosis. So I've said here this can be very stressful, I mean for the people rather than for the animals, because this is usually a very taxing situation if you are called to pronounce on whether a farm has foot and mouth disease or not. So while I go through this slide, I'd just like you to look at these two pictures because I'm going to ask you in a minute for your opinion as to whether they are cases of foot and mouth. And these are real cases that people were faced with in 2001 in the UK when they went into the field. They had to make a decision, does this animal have foot and mouth disease? And on the strength of what they decided, not only was the herd in question culled, but sometimes also half a dozen contiguous herds surrounding. So the differential diagnosis you have to consider is other vesicular viral diseases, and we've already mentioned vesicular stomatitis, swine vesicular disease, vesicular exanthema, bovine papillomatosis. There are others such as IBR, certain presentations of BVD. But a very important differential is this one, because traumatic cases, particularly in the mouth, are very easy to mistake for foot and mouth disease, also toxicological and corrosive injuries. So one thing that has been developed more recently to help you in the field to make your diagnosis is that there are now some pen-side diagnostic tests available, and they are essentially of two types. So you have the very simple disposable lateral flow device, where you can take some vesicular fluid, or you can take some epithelium and grind it up with a simple pestle and mortar, and then you can put it, the liquid on here, and you can see whether you get a line in the test line, and this control line should always come up positive. But in addition, there are now a variety of molecular tests based on RT-PCR or RT-LAMP, various other combinations, which of course are more sophisticated and expensive, but are also much more sensitive methods for detection. The issue perhaps for discussion about these pen-side tests is how well validated, regulated, and accepted they are. You have to think carefully about what are the implications, especially for a first diagnosis of foot and mouth disease in a free country. This is very different from the situation perhaps where you already have confirmed that foot and mouth is occurring and you are trying to confirm subsequent cases where your level of certainty and confidence need be much less. Okay, so that's the first test, is whether you can actually diagnose it as foot and mouth disease. But when you're in the field, you might be expected to do more than that, because actually it's very important that you not only decide whether it's foot and mouth disease, but how old the lesion is. And this is an important part of your workup of the case, because it's necessary for both forwards and backwards tracing. So in terms of forwards tracing, you're trying to work out where the disease might have spread, if it is foot and mouth disease, to other herds. So you want to know how long have there been animals infected and shedding virus on the farm in question. So that means you need to look at preferably all, and certainly as many as possible, of the animals on the farm, and you need to work out what is the lesion age profile for the farm. Because then you can use that with information that's available about shedding in relation to the lesion ages to work out what is the risk period in terms of trying to trace forwards. And of course, if you have a meteorological office that produce these nice maps, they can also look at when air is likely to have been blowing in a particular direction and could have spread the disease in different places. But it's also important for backward tracing, because you want to know when did the infection arrive on the farm, and for that you need to know the date of the oldest lesion. So why is that important? Well, here is an example. So here you have a rather old lesion on the tongue. Again, it's not all that easy to see from this picture. I'll show you some more pictures in a minute. But this is a healing lesion, and it's maybe about 10 days old. So if you're on the farm on August the 4th, and you have decided that it's 10 days old, you can work back to when it was infected. And that, of course, depends on the incubation period, which we said is between 2 and 14 days. So this is the window of time when it's most likely that this farm was infected. And you can even be a bit more refined, and you can say that although the incubation period is this wide, it's generally narrower, and this is the most likely period. And then you can look at your contacts and you can rank them according to risk. So you maybe have the fact that here there was an animal purchase and was brought onto the farm, but you can see this is too late to have introduced the disease. Here you can see there was a vehicle came onto a farm, perhaps from another infected farm, and this would be pretty well spot on for bringing the infection into the farm. And here you have perhaps an airborne virus plume, which is also a possibility because this is a low-dose infection, and then you tend to get a longer incubation period. So this is an important part of the clinical workup, is the lesion aging. So this is just to go through very briefly the lesion aging. Sometimes I show dozens of slides, but I don't think we've got time for doing that. So here we can see in a pig, for instance, on a pig's foot, a typical coronary band lesion, which stands out because it's very white and blanched, and that's an unruptured vesicle, so we call that day 1. And from that, as far as clinical sampling, we could either cut and remove some epithelium, or you could even use a syringe and needle to extract vesicular fluid. Here we can see a ruptured vesicle between the claws of a cow's foot, and you still have these large epithelial flaps hanging around the edges of the lesion. So that means that it's quite fresh, because these very rapidly get rubbed off. And so we're talking day 2 to 3, and you could certainly easily collect these pieces of tissue here, and they would be ideal for a diagnosis. Here you've got an older lesion. This is probably day 4 to 6 on the dental pad of a cow, and you can see that all the epithelial tags have been rubbed off. and the edges are all now smoothed. You can also see that you've lost a lot of the bright red coloration, and you've got fibrin deposition, which is this sort of gelatinous tissue on the center. This is not much good for foot and mouth disease diagnosis, and you would be hard-pressed to get a decent sample from that animal. You could take a blood sample, because there might still be a viremia, and you could look for early antibody, and you could also take a probang sample to look for virus in the throat. This last one then is a late stage lesion on the tongue, and you can see this is perhaps day 7 to 14. You've got reepithelialization coming in from the edges and new epithelium growing across, and the only way you could get a diagnosis on this is by taking a blood sample for antibody and a probang sample to look for virus in the throat. If you have a suspect acute case, you should look for virus in about 6 animals from each epidemiological unit. It's a balance between taking enough samples to be certain and not wanting to overwhelm the laboratory. So vesicular material, so you should try to take as large a piece of epithelium as possible. It should be put into buffered phosphate saline with 50% glycerol to stop bacterial growth. A blood sample you can take, which you can look for viremia, and you can also look for antibodies. The viremia is free in the serum, so you can take a clotted blood sample, but some laboratories who want to use automated PCR prefer to have anticoagulated blood because it's easier to put through their system. If you suspect a convalescent case, then again you have to look for antibodies, and if it's a ruminant, you can take a probang sample. So here is the famous probang samples. This is one for a sheep, for a calf, and for a full-size cow. And if you are taking many probang samples and you have to decontaminate between animals, you should use a 3-bucket system, which is one with water, one with a mild disinfectant, and the other one with water. So you clean in water, you disinfect, then you put back into water to rinse, and then you're ready to go with the next sample. So a little bit about prevention and control then. A lot of this is generic, not just to foot and mouth disease, but to other things. Some of it, I think, has already been discussed by Cedric this morning, so I can go through it quickly. So, of course, for control, you have to be able to control the importation of susceptible animals and their products, and you have to remember that also wildlife and illegal movements are very important. It's necessary to have education about the risks of bringing back disease from countries where it is endemic, and I've already mentioned the specific risk of people who go to work on farms. Because of the risk of swill fed to pigs, this should all be cooked, or even better, ban its use completely. So in the UK in 2001, foot and mouth disease was introduced by feeding swill to pigs, even though there was a law that required all swill to be cooked, but of course the law was not fully enforced. Biosecurity on farms to restrict access to livestock by public and wildlife. You need to have the ability to restrict and regulate animal movements, and you need to have updated contingency plans, and we've heard a lot about them already. This is a picture of some of the people trying to get across the Mediterranean from North Africa into Italy. I've already showed you that there's quite a lot of FMD in North Africa at the moment, so this is a bit of a worry, even if you might think that there is not a lot of space for any animals on this boat. Sausages, perhaps. Okay, so contingency plans, I think these have already been dealt with. I only really reiterate the first point, which is the most important one, which is that foot and mouth disease outbreaks are crises, that things happen very quickly and you need to be prepared beforehand because there's no time once the crisis hits you. So here are some of the things that you have to have, and I think this has all been discussed. From a point of view of control and eradication, the key is early recognition, because if you don't recognize the disease early, then it will soon get out of hand and you will have an epidemic rather than a small number of outbreaks. So the keys for early recognition is education, both for the farmers and for the veterinarians, and I guess that's what we're doing here. But also, as has been mentioned this morning, compensation is absolutely critical, because if people are not incentivized to report the disease, you won't succeed. You have to have quarantines and area standstills. You have to be able to do epidemiological inquiries and tracing. And of course, these are greatly helped by animal ID systems. And this is one of the key reasons why the developed countries are so much better at controlling foot and mouth disease, because they usually have these systems well in place. So stamping out is used extensively in the developed world. Vaccination is used more extensively in the developing world. You have to have active surveillance to check that your farms are free of foot and mouth disease, and to do various serology to get back your free status. So the prospects for international foot and mouth disease control, as I said at the beginning, it to a certain extent mirrors economic development, and of course economic development is a positive force in the world. So for example, there is an improving situation in China and India associated with economic prosperity that is growing in those two countries, and that will have an enormous impact on FMD in Asia. Unfortunately, there's less progress in Africa, and there are also more insurmountable difficulties there with wildlife, particularly African buffalo. Very positive is the developments in South America with no outbreaks since 2012. There's a major global coordinating effort by OIE and FAO to control foot and mouth disease with progressive control pathways and regional roadmaps and regional meetings. We may get some breakthroughs in new vaccine technology. There are new vaccines coming onto the market. There's a new vaccine licensed in North America based on an adenovirus vectored vaccine, and there are also new vaccines based on recombinant technology, which are genetically engineered capsids.